Labour might be on the brink of a new crisis. Rachel Reeves' rumoured pension reforms could trigger an exodus of doctors from the NHS. Yes, you heard that right. An unprecedented number of doctors might just hang up their stethoscopes for good if Labour moves forward with these changes. Here's what's happening and why it's a big deal. The British Medical Association, or BMA, has already fired off a warning to the Chancellor. They're saying this so-called pension raid could be a huge blow to doctors. If Labour changes the lifetime pension cap, doctors may have little choice but to either cut back on hours or just leave the profession altogether. Now, let's break it down. For those who aren't pension pros, the lifetime cap was previously set at £1.073 million, which sounds like a lot. But get this, under current rules, if a doctor's pension savings go over that amount, they'd face some massive taxes, 55% for lump sums, or an extra 25% on top of income tax for gradual withdrawals. Last year, Jeremy Hunt scrapped that cap, encouraging experienced doctors to stick around. But Labour's hinted they might bring this cap back, and if that happens, it's not hard to see why doctors could feel like the system's working against them. Hitting that cap would mean they're taxed more for saving more, and that's on top of already demanding hours and high-stress work. And with Labour's plan to reintroduce the cap, the BMA is raising the alarm that it'll worsen our already overloaded NHS waiting lists. The BMA isn't just complaining though, they're sending serious demands to the Chancellor, pushing for changes to the annual allowance and taper rate, which affect doctors and other highly paid public sector workers. According to NHS pension experts, doctors are really getting squeezed on tax with each added pound they earn. Some say it's almost like doctors are being penalised for their years of hard work. Think about it. Doctors reduce their hours or leave, and who's left holding the bag? Patients who will face longer wait times and more difficulty finding GP appointments. On top of this, there's frustration in the private sector. Rumour has it that Labour might raise national insurance contributions for employers, unless they're in the public sector, so it's a 1-2 punch. Higher taxes for some, a big bill for others, and no real relief for healthcare providers. Tom Selby from AJ Bell even weighed in saying, all this speculation around pensions is damaging trust in retirement saving. He's urging the government to prioritise stability in tax policies rather than adding layers of confusion and potentially sparking a new wave of public sector strikes. So, what do you think? Are these pension changes a necessary tax strategy or a threat to the healthcare system? Let us know in the comments below. Don't forget to like and subscribe to stay in the loop with our latest updates on news that affects you.